Hello everyone, welcome again to my YouTube channel. I'm Dr. Annie. I'm an ophthalmologist, and today I'm going to be discussing something majority of us would have. In fact, everybody will develop a cataract as we age. So most people would have it after the age of 50, 55, some people even have it younger. So it's really common. I'll be talking about cataract. I'll be talking about what a cataract is, signs and symptoms, so things we might notice that will give us a hint that we probably might have a cataract. I'll be talking about how to prevent cataract, and I'll also be talking about what causes cataract. So please stay tuned and don't forget to like and don't forget to subscribe. So let's start. What is a cataract? We have different parts of our eye. We have the colored part, that's the part we call the iris, and just behind the iris we have this structure we call the lens. So the lens is really important. It serves like an intermediary. It helps to focus all the light coming from outside on our retina. Our retina is at the back of the eye, and this is where images are like translated to the brain and depicted and produced. So it is really important that all the light coming from outside is properly focused on the light sensitive part of our eye, which is our retina, and that is the job that the lens does. So the lens is really important. This structure contains proteins, contains water, and sometimes something happens and it gets clouded. It loses its transparency and it can't focus light as normally as it would at the back of our eye, and this is what a cataract is. So our lens is usually transparent, and when it becomes opaque, when it becomes clouded, when it loses transparency, this is simply a cataract. Before I proceed, I want to talk about the layers of the lens. The lens is like an onion. It has several layers, and the outermost part, that's the part that envelopes all the other structures, is called a capsule. So the outermost layer of the lens is called the capsule. The layer that follows the capsule is called the cortex, and then the innermost layer, the part that is inside this wrapped part, is called the nucleus. And so we can have different kind of cataracts. Cataract can affect the capsule in front, and it's an anterior subscapular cataract. It could affect the way behind, and it's a posterior subscapular cataract. It can affect the cortex, and it's a cortical cataract, or it can affect the nucleus, and it's a nuclear cataract. Sometimes the clouding of this lens involves every layer, every part has lost its transparency. The lens is totally opaque, and we call it a mature cataract. Sometimes just a part of the lens has lost its transparency, just a part is opaque, and in this case we say it's an immature cataract. So we can have a mature and we can have an immature cataract. We can also have hypermature cataract when the lens has really absorbed a lot of fluid, and then the front parts, which I described about the capsule, has now become wrinkled. So the lens could have a mature cataract, immature cataract, or an hypermature cataract. It could also involve different layers of the lens. So we could have a nuclear cataract, a cortical cataract, a capsular cataract. So yes, there are different types of cataracts. Let's move on and discuss what can cause the lens to become clouded, to lose its transparency, and so the individual then develops a cataract. The first and the most important one is age. Yeah, I mentioned that as we age, the lens is no longer as strong. It undergoes some changes, just like the rest of our body is undergoing the aging process, and then there's loss of its normal structures. The cells become damaged, destroyed, begin to absorb a lot of fluid. There's change in the proteinous structure, and then the lens becomes clouded. This usually occurs over the ages of 40, over 50, over 55. It's important to note that a cataract can occur at younger ages. I've operated with younger patients, even children. And what happens in this case is that it's no longer an age-related cataract, but it's a cataract that is caused by something else. So an important cause is age. Another thing that causes cataract, especially in children, will be trauma. So yes, an injury to the eye will distort the normal capsule, the normal cortex, the normal nucleus. The lens is no longer intact, and this damage will cause certain changes in the structure of the lens, and a cataract can then develop. So we have age, we have trauma. Also, certain diseases put one at risk for developing a cataract, or even enhances, even if the individual was going to develop a cataract, it speeds up the process. Diseases like diabetes mellitus. Some things could also predispose one to having cataract, like smoking, alcohol, certain nutritional deficiencies, although there's still so much controversy about this. Other things that could make an individual develop a cataract to be exposure to ultraviolet radiation. Yes, this is also an important risk factor. So cataract can also develop in children, and some babies are even born with cataract. We call this congenital cataract. So what would cause a baby to be born with a clouded lens? Many things like genetic causes. It's associated with diseases like Down syndrome, like Edwards syndrome. Sometimes the mother, when she's carrying the baby, has certain infections like toxoplasmosis, like rubella, like cytomegalovirus, herpes simplex, and it can cause certain disorders in the baby, and the cataract can actually be one of them. Other things will be chromosomal abnormalities. Yes, this can also cause a baby to be born with a cataract. And an important thing that could cause a baby to be born with a cataract to be genes, like I said earlier, and this will be seen in like a very strong family history. So you have a mother who was born with a cataract, and then you now see her having a child, giving birth to a baby that also has cataract. So all this are things that can cause cataract or predispose one to having cataract. So let's discuss the signs. How do I know I have a cataract? So there are different signs, there are different symptoms that one might have when one develops a cataract. And the first one will be blurry vision. So the vision is foggy, the vision is hazy, images are not clear, images are looking blurred, images are no longer sharp. This is a really strong sign that one might have a cataract. Another thing will be reduction in intensity of colors. So colors are not clear, colors are not looking as sharp. Yes, a cataract can do this. Another thing will be like changes in refractive errors. So I once used spectacles because I was far-sighted, or because I was nearsighted. Now I notice my spectacles are no longer working. For instance, a nuclear cataract usually causes the individuals to see things that are closer to them, so you become nearsighted. So prior to having a cataract, you could see far, but you couldn't see near properly, and then you develop a cataract, and now you can just see near more clearly. So it helps, it actually makes one nearsighted, and then you begin to lose your distant vision. So a cataract can actually cause blurry vision, hazy vision, changes in refractive errors, could also cause reduction in intensity of colors. Another important thing that a cataract can cause is it can make light scatter. So I mentioned earlier that the lens is an intermediary structure. So light coming from outside, it helps it to focus at the back of the eye. But when there's a cataract, the light no longer focuses, and so the light scatters, and we describe this as glare. So individuals, especially individuals with posterior subscapular cataract, will come into my clinic and complain that when they're driving at night, everything, or when they're in bright light or in sunlight, the light scatters. This is a really strong hint that one might have developed a cataract. Another thing will be difficulty seeing at night, difficulty driving at night. All these are signs and symptoms of having a cataract. To manage a cataract, it depends on the age of the patient and if the cataract is mature. In another video, I'll discuss management of cataracts. Management is surgical. There are different surgical options. I'll also talk about prevention, because there are still some tips and some things we can do to avoid developing a cataract. If you have cataract, if you have had cataract surgery, please share your experience in the comment section. Also, don't forget to like, don't forget to subscribe, and also hit the notification button for more videos about your eye health and things that could help improve your eye vision. Thank you so much. Have a lovely time.